So, a surrogacy journey, it's an incredible path, but let's be real, it can have a lot of twists, turns, and questions. And probably the biggest question on everyone's mind is everyone going to be safe and healthy? Well, today we're going to zero in on one key step that helps answer that question with a confident yes. Let's get into it. Okay, so what is this thing? It's called the Maternal-Fetal Medicine Consultation, or MFM for short. And I know what you might be thinking. Another meeting? Really? But what if we looked at it a different way? Not as another hurdle to jump, but as an essential safety net for the surrogate, for the intended parents, and, of course, for the baby. So let's dive in. What actually happens in one of these MFM consultations? What can you really expect from this kind of expert review? First things first, what even is MFM? Well, it stands for Maternal-Fetal Medicine. It's a specialized area of obstetrics. Now, don't let the term high risk scare you. In the world of surrogacy, their role is all about being proactive. Think of them as a specialist who can medically see around corners, making sure the road ahead is as clear and safe as possible for everyone. So here's what the FFM specialist does, and trust me, they are thorough. First, they'll do a deep dive into the surrogate's entire medical history, paying super close attention to any past pregnancies. They're looking at everything, like how a previous C-section healed or if there was ever even a hint of high blood pressure. After this detailed review, they'll give their specialized opinion, basically giving the green light for the journey to move forward. And this is so important to get. The whole point here isn't to go looking for trouble. It's about being smart and proactive. It's about putting a plan in place from the very beginning to make sure this pregnancy is as healthy as it can possibly be for both the amazing surrogate and the baby. Now, here's something that might surprise you. This consultation, it's not always just for the surrogate. It's often a collaborative meeting, bringing everyone to the table so the journey can start with everyone on the exact same page. Yeah, and you can see it laid out right here. For the surrogate, it's like getting confirmation from a top specialist saying, yep, you're healthy and ready for this. That's huge for peace of mind. And for intended parents, it's that deep breath of relief, knowing their surrogate's health is the absolute top priority. It just creates this shared foundation of safety and trust right from the get-go. So why bring the intended parents in? Because this whole thing is a partnership, right? When everyone's in the same room, you can talk openly about any potential risks, you can set realistic expectations together, and you can make decisions as a team. I mean, wouldn't you want that kind of open book policy from day one? All right, I'm sure you've got questions popping into your head right now. A process like this is bound to bring them up. So let's do a little rapid-fire Q&A and tackle some of the most common ones. First question on the list. Is this MFM thing mandatory? Like, does everyone have to do it every single time? The short answer? Nope, not always. But, and this is a big but, it's considered a best practice by many of the best IVF clinics out there. And honestly, if your clinic requires it, that is a great sign. It tells you they are completely committed to the highest safety standards possible for everyone involved. Okay, this next one is a biggie, and it's a really sensitive one. If a surrogate is asked to see an MFM specialist, does that mean something is wrong with her health? No, 1,000 times no. And this is so crucial to understand. An MFM consult is a precautionary measure. It's like you'd get a home inspection before buying a house, right? Not because you think it's falling down, but because you're being smart and safe. It's the exact same idea. It's just a sign that everyone is focused on the best, healthiest outcome. Okay, let's get practical for a second. Let's talk about the money. Who's footing the bill for this expert review? That cost falls to the intended parents. It's typically a few $100s, and it's really seen as one of the first, most important investments in the health and safety of the entire journey. All right, this is probably the question everyone's afraid to ask. What if the doctor reviews everything and recommends not moving forward? Hearing that news would be incredibly difficult for sure. As tough as that would be to hear, this is exactly why this step is so vital. It's the safety net doing its most important job. A decision like that isn't a no to a dream. It's a yes to protecting everyone's health. It's about preventing what could be much bigger risks and honestly, so much more heartache down the road. So when you step back and look at the big picture, you see that the MFM review is way more than just another doctor's appointment. It's really a cornerstone for building trust and confidence in the entire journey ahead. It all boils down to these three pillars. The MFM ensures the surrogate's health is the top priority. That, in turn, protects the baby's health. And when you have those two things locked in, you get this profound, incredible reassurance for the intended parents. It's a win-win-win. You know, there's a quote from our source material that just hits the nail on the head. MFM consultations exist to protect the health of the surrogate, the baby, and provide reassurance to intended parents. It's that simple, but man, is it powerful. So the next time you hear about an MFM consultation, don't just think of it as another box to check on a long list. Think of it as the foundation for confidence, for safety, for a healthy start. Which really just leaves us with one final thought. On a journey as profound and life-changing as this one, how much is that kind of peace of mind truly worth?